While doctors are there to help you, you are the expert in your life and your health. This tool can help you decide if you want to take medicine to reduce your risk of stroke due to atrial fibrillation. Normally, the heart beats regularly, pumping blood to the rest of the body. So, what is atrial fibrillation? Atrial fibrillation, called AFib for short, is when the upper chambers of the heart beat very rapidly and irregularly. Some people feel a fluttering in their chest. Some people don't feel well. Many people feel nothing at all. Blood is usually moving through your heart. When AFib happens, some of the blood doesn't move. When blood doesn't move normally, it can form a solid clump called a clot. If the clot breaks off and is carried away in the bloodstream, it can block the flow of blood to your brain. Without blood, the blocked part of the brain will start to die. This is a stroke. A stroke caused by a clot can happen anytime, any place. If you have a stroke, you may die from it. Or it can leave you disabled and unable to take care of yourself. The good news is that with medicine, most people with AFib thrive and have full lives. The most common medicine to prevent blood clots is an anticoagulant, also known as a blood thinner. Many people take blood thinners, so you may have heard of them. Available blood thinners include warfarin, also called Coumadin, and the new blood thinners, dabigatran, also called Pradaxa, rivaroxaban, also called Xarelto, apixaban, also called Eliquis, and edoxaban, also called Savaysa. Aspirin and similar medications such as clopidogrel, also called Plavix, prasugrel, also called Effient, or ticagrelor, also called Brilinta, do not do a great job of protecting you against stroke caused by AFib. Even if you feel fine in AFib, taking a blood thinner will greatly lower your risk of stroke. But no medication is perfect, and there are things to consider. Taking a blood thinner can make you bleed or bruise more easily. Sometimes people bleed inside their stomach. This is uncommon and does not usually lead to long-term health problems. An uncommon but very serious problem would be if you started bleeding in the brain. It can be hard to measure risks and benefits, so you and your doctor will talk about your health, your lifestyle, and your personal risk of stroke. For most people, the benefits of taking a blood thinner outweigh the risks of taking a blood thinner. Your doctor may suggest you take a blood thinner based on your personal risk of stroke. But remember, you and your doctor can work together to help you make this decision, and you can always change your mind later. You can think of your decision as two paths. On path 1, you could say no to blood thinners. I have a higher risk of bleeding because of other health problems. I decided to live with the risk of having a stroke. On path 2, you could say yes to blood thinners. I can't risk having a stroke and losing my independence. Before choosing a path, people like you have found it useful to learn more about the benefits and risks of each choice. Talk to your doctor and use this tool so you can make a choice that you are happy with.